The last thing that you need to be concerned about regarding any kind of locking or catching or popping sensation in the knee is the kneecap. And this is actually very common. The kneecap here tracks in this groove right here. This is called the trochlear groove. The kneecap goes right down the middle of this groove, and it's usually centralized within that groove. Occasionally, patients can have a history of dislocation of the kneecap, or can have what's called maltracking of the kneecap, where the kneecap actually tracks laterally on the outside of that groove and rubs up and down this condyle here of the cartilage. That can cause pain with stairs, squatting, kneeling, any kind of bending activity. If you're in a movie theater and you go to stand up and you feel a click or a pop and it hurts, that might be the fact that your kneecap was sitting out here laterally and then it's popped back into the joint in the trochlea here. And that's easily addressable with strengthening exercises as well as conservative measures. Now, if you do have a dislocation of the kneecap where it pops completely out of joint and you physically have to pop it in, or a trainer pops it in, and that can be a little bit more serious because some ligament injury can occur and there can be some cartilage defects that need to be evaluated by an orthopedic surgeon, probably with an MRI and a physical exam. And just depending on what the findings are will determine the treatment, and sometimes it's even surgery. So once again, if you do feel a pop or lock of the knee followed by pain and diffusion, I highly recommend be evaluated by an orthopedic specialist for further recommendations. I hope this sums up some of the basic answers regarding feeling popping in the knee. If you have any further questions, feel free to visit my website at www.jmichaelbennett.com or www.orthopedicsportsdoctor.com, or feel free to call my office at 281-633-8600. Thank you very much.